Okay, this is going to be a video tour of the muscles of the hip and thigh, knee and leg, and the foot. So, on muscles that move the hip and thigh, you need to pick one, either the gluteus maximus, the iliopsoas, the sartorius, or the adductors, because you should have added adductors to this. So, right here we have the gluteus maximus. Okay, so you can see it originates on the iliac crest, and then the sacrum and the coccyx, and then it inserts over here onto the really onto the iliotibial band. Can't see that, but you're going to insert it over here onto the femur, so it's a big rectangle muscle going across right there. That's a gluteus maximus. Okay. The iliopsoas is a combination of two muscles. This is the iliacus muscle, which sits on the ilium, and then this is the psoas major, which originates up on the lumbar vertebra, and then they both insert down here onto the lesser trochanter of the femur back here. Okay, so this one's kind of a fan shape, and this is more just a rounded muscle right there. Again, on all of these, you'll be wanting to take pictures of them. The sartorius, the longest muscle in the body. So the sartorius is right here. It's a thin strap-like muscle. So you just roll this one out. It's going to originate on the anterior superior iliac spine and then insert on the medial side of the tibial tuberosity. So this is the sartorius right here, this long, thin, strap-like muscle. Okay. And then the adductors originate on the pubis, and then they're going to insert down the inside of the femur. And so this is all the adductor muscles. There are three of them together, and their striations are going to kind of be linear at an angle from here down. So this is the adductor group. Okay, so you should be doing one of those, either gluteus maximus, iliopsoas, sartorius, or adductor. That's the muscles that move the hip and thigh. And then we go to muscles that move the leg, and you should have the rectus femoris, the vastus lateralis, and the vastus medialis. Those are part of your quad muscles. Vastus intermedius should be taken out or changed to vastus medialis. Okay, so you should do one of the quadricep muscles. So here is the rectus femoris. It originates on the anterior inferior iliac spine, so there's a little point right here that it originates, and it inserts on the tibial tuberosity. Okay, so it goes from here. Notice the striation, so the tendon here and here, and then you have kind of a tendon down the middle, and then the striations go like a feather. Here's the midrib of the feather, and the feather striations come in at an angle. Okay, that is the rectus femoris. I believe this one was supposed to be the vastus lateralis. So it originates on the greater trochanter and the linea aspera, which is just a line on there of the femur. And then it also, and here's the problem, it should be intersecting over here onto the, it should be inserting onto the tibial tuberosity. So that muscle is incorrect with the insertion. So let's see. That was supposed to be vastus lateralis. This is the vastus medialis. Almost finished vastus medialis. So it originates on the linea aspera and the intertrochanteric crest between the two trochanters, and it inserts on all of the quad muscles, insert on the tibial tuberosity, and the striations aren't drawn, but the striations should be coming down this way, because this is the vastus medialis on the medial side. Okay, so the striations should be coming this way. So those were the three quadricep muscles you can pick from to do rectus femoris, vastus lateralis, or vastus medialis. And then you need to also do one of the hamstring muscles, which are the bicep femoris, the semitendinosus, and the semimembranosus. As we get better at this, hopefully you get better and need less help. So this is the semitendinosus, I believe. So it originates on the ischial tuberosity and then inserts on the, because I took it off there, on the proximal medial surface of the tibia. So that would not be, it should insert over here. Medial surface. Okay. So sorry. Semitendinosus originates on ischial tuberosity and then inserts on medial surface of the tibia. So remember, the tibia is the lower bone. So there's the tibia down here. You should have, still need some tendon delineation here and down here. This is not 100% correct. And then draw the striations in, and they're going to be linear. Okay. And then the semimembranosus right here originates on ischial tuberosity and then should be inserting on the posterior surface of the medial condyle of the tibia. So both of these insertion points are wrong. So they all are starting up here, sorry. And then I can't get it quite to work, but here would be the medial surface of the condyle. So it's not quite long enough. It needs to go all the way here and then delineated for the separating the tendon. And then you have the striations right here. Okay, so this one just needs to go a little bit longer. And then the bicep femoris, don't think we have a bicep femoris muscle. So on the bicep femoris, it's going to be lateral, so it'll be to the outside. So I'll just kind of show you on here. On this one where it should be. So the long head is going to be the ischial tuberosity, which of course is the ischial tuberosity. And then you also have a head that's on the back of the femur. And then they're both going to come down and insert on the fibula right here. Okay, so the bicep femoris actually inserts on the head of the fibula. And so this is the lateral muscle. And you draw your tendons, and it should have straight striations. If we look at this right here, so here's our bicep femoris and our semitendinosus. You can see both of them, the striations are parallel. The semimembranosus is underneath it. You just can't see it from here. And then if we go to our, so you should have one quad muscle, you should have one hamstring muscle, and then you're going to have one muscle that moves the foot and toes. So here is choice the gastrocnemius. Okay, so it actually has two heads. Each head is on the lateral condyle of the femur. Okay, so lateral condyle of the femur. You have two little bellies here, so you can see the line that separates them. The striations are straight. And then you have this long Achilles tendon, which inserts on the calcaneus right here. So this is your Achilles tendon. And then here we have the soleus, which is a synergist. So the soleus originates on the head and proximal shaft of the fibula and the medial border of the tibia. So it should just be up here a little higher, and then it also inserts via the Achilles tendon to the calcaneus. So straight striations, here's our delineation. And then the tibialis anterior is on the front. Okay, and it originates on the lateral condyle of the tibia. So it's going to be this outside part of the tibia, and then it comes down, and then it actually inserts on metatarsal 1 and the medial cuneiform. So the tendon, look, the lines delineate here and here, and this is a really long tendon that comes down here. Okay, and the striations on this one are also straight. So hopefully that helps on the rest of on all the leg muscles. If you have questions, don't hesitate to email, or you can come to a tutorial section. For each of these muscles, I do need pictures individually. Like here would be a picture of the adductor that I can clearly see. Here would be a picture of the tibialis anterior. Now this, if there's mistakes on it, I'll let you fix it if you come and ask in advance. If there's not, you might be losing some points. I've pointed out some errors on here, so hopefully you can fix those errors when you create it. All right, thank you.